Hey, it's Dr. Mitch. Let's start on Motivational Interviewing 2 here in the treatment series. I want to ask a question that will help you test your knowledge. So, MI suggests A, motivation is a trait, B, abstinence is the only goal, C, ambivalence is part of change. Well, of course, it's C, right? Motivation is not a trait, and MI, we know it's a state. It can ebb and flow. Abstinence is the only goal. Abstinence is a great goal, but maybe that's not what the client wants to do, so let's be flexible. And C, ambivalence is part of change. Yes, hooray, ding, 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 ding. Yes, if it weren't a struggle, right, if you weren't a little conflicted, odds are high you would have changed on your own. Let's check out another item. MI requires A, confronting denial, B, rolling with resistance, or C, differential diagnosis. All right, well, let's see here. Confronting denial doesn't really sound like a confrontational therapy, right? Never gonna pick up the rope, you're never gonna have a tug of war, so that sounds like actually more the old Synanon alcoholism treatment. Some of my 12-step friends still think that works too. Rolling with resistance, now that sounds like good old Carl Rogers, right? And indeed, that's the right answer. C, differential diagnosis. No, we don't care what the label is, right? It doesn't matter if you qualify for a label or not. What behaviors do you want to change? How do you want to be? And what do you want to feel when you're doing stuff? Right? Oh, here's another one. MI relies on this old white guy's work. So, well, both sexist and racist on this one. Sorry, guys. But bottom line is it A, Ellis, B, Rogers, or C, Skinner? I gave it away a minute ago, didn't I? It's good old Carl Rogers. Ellis is for cognitive behavior therapy. He's the guy who says you shouldn't, do shoulds and musts and stuff like that, and calls it masturbation. And when I make that the right answer on the test, everybody thinks it's a joke. And Skinner, Captain Operant Conditioning. He thinks psychotherapy is basically just an opportunity to engage in previously punished behavior. He doesn't really, yeah, it's not going to help. All right, one more. In stages of change, if you've quit drinking liquor for a month but don't quite feel like you've got it licked, what stage are you in? Is it A, relapse, B, contemplation, or C, action? Let's think this through, right? You're already quit, but you don't feel like you can have it all mastered. So that's not relapse because you're quit. Contemplation, well, you've already given it a bunch of thought and you've even quit for a little while. So it must be C, action. The action stage it is. All righty then. So let's move on. The next part of how we, help folks move through the stages of change, support self-efficacy, meaning help them have realistic but good feelings about their ability to make this change, either through training, exercise, skill, whatever, right? So a person's belief in the possibility of change is an important motivator. Why would I try to do something if I knew I had no chance of doing it, right? If I have no self-efficacy, perhaps the treatment provider can offer me some hope, give me some coaching and stuff like that, and then I will maybe move along the stages of change and be more optimistic. Right? The client is responsible for choosing and carrying out the change. All right, so I emphasize this more for the grad students, of course, because they're trying to make this happen, and when their clients don't change, they think it's all their fault. But when their clients do change, they try to take credit, and they're like, "Look, you pretty much, if you're doing this right, you got nothing to do with it." We do note that the folks who are the most empathic seem to be the ones who have the best outcomes in these treatment outcome studies. And the bottom line is that the therapeutic alliance, that link between the therapist and the client, is usually our best predictor of outcome. better than education or what degree the therapist has or how closely they stick to the manual or any of that. It's just, is there a good therapeutic alliance? Are you on the same page? The counselor's own belief in the person's ability to change becomes a self-fulfilling prophecy. This is a tough one, but it's true. Not only must the client believe in his or her ability to change, the therapist really has to be into it too. And if you're the counselor and you're not convinced the person can change, set a more reasonable goal, right? Or train them up, get them the skills that they need, help them find the resources that are going to be necessary. And then as you believe it, they'll believe it, it'll happen. Not in a crazy, airy-fairy, The Secret kind of way, but just when you believe you can do something, you try harder. You focus your efforts. If you believe your client's going to do something, you're going to express your strategies to that person in a way that's going to make it clear how it works and that you think he or she can make a big difference on it. All right, well, so how does this work like literally in session? How do you make this happen in a session? Well, obviously I can't teach you guys all how to be therapists, but I am going to say that these skills might help you get a date or two. So listen very closely. Use your OARS. I've been married 22 years and these are why. OARS is the acronym. I want to do SOAR, but then summaries would become first. And how can you summarize something that you haven't even done yet? So O stands for open-ended questions. We'll get into what that is, but basically questions that can't be answered yes or no or one word. So how do you feel about, right? Tell me about alcohol. What's your deal with cannabis, right? Not ever smoke pot, never get a DWI, right? That's not going to build rapport the way the open-ended questions can because it gives the client an opportunity to talk. Affirmations. Now, this isn't the every day and every way I'm getting better and better. It's letting them know when they're making progress that you've noticed it. Literally saying, you got it. Right on. I get you. I understand. Or good work. Right? So that the client sees that you see what he or she wants and you're affirming that it makes sense, that it's normal, right? That it's a good strategy and that they're making progress. Reflections, all right, we're going to get into this in detail, but basically reflect back to the person what you heard him or her say, because that way they know if you get him or her, but also the people know, like, what I'm saying makes sense or not. Because sometimes you hear it coming right back to you and you realize, wow, that's just, nah, I'm exaggerating, or that's a little irrational, or it's not as bad as I make it sound, or now that I say it, it's not so terrible, right? So we'll get into different types of reflection later. And then finally, summaries. You guys will notice that every few minutes, the therapist is going to say, okay, we talked about this, so we talked about this, we talked about this, right? So that you kind of know what's on the table, what's going on. And at the end of the session, try to cover the plan, right? Summarize what the plan is. Notice it never says explain. It never says tell them what to do, right? Just do these. Things are going to go great. So the open-ended questions. Do you like to drink? Okay. Is that open-ended? Nah. Right? It's a yes or no question. Yes. Does drinking cause you problems? Is that an open-ended question? Nah. Right? It's just one word. So obviously these aren't going to get me very far. I'm not going to build a lot of rapport with closed-ended questions. In contrast, how about some open-ended? What do you like about drinking? Now, almost invariably, clients will say, damn, nobody ever asked me that. Tell me some of the pluses about drinking as much as you do. Wow. Right? If nothing else, they get to see what they're in it for, right? What are the things that seem to be driving them? What are the components that matter? And often it ends up being, this is how I get my social support, or it's how I don't think about my trauma, or like they often uncover some other problem that may be super relevant to the intervention. What problems have you encountered because of your drinking? Right? And the first reaction is always none. And then it's like, well, no, wait. And then you got to listen to the drunkalog, but that's what being a good therapist is, right? You're going to let them tell the story, build that rapport, and then keep reflecting, as we're going to get into. And then affirmations. Basically, these are how you can communicate empathy. So yeah, great job, wow, you did it, awesome job. If they're doing a good job, of course. But even just, I follow, I get you, I know what you mean. Right? That is really affirming, especially if you don't know if you're the only one who's ever done whatever this is. Right? Oh, I was watching a session where this woman was trying to make a decision about when to stop breastfeeding. And she just had no clue even how to go about it. I think she was going to make the poor baby go cold turkey. Right? And the therapist was really good about it and weighed the pros and cons with her and realized, like, no, you know what I want to do? I want to cut out one feeding a day. And then we'll work down from there, right? And it was very affirming, really validating, and helped her answer some questions she had no answers to. So, reflections. Got a couple of different kinds here, and I just want to emphasize that it really is just repeating back what the client said, but with a twist. All right. And I know you're thinking, oh man, if I do that, the people are going to say, stop mocking me, or knock off the reflections, or anything like that. And I got to admit, my dad, like, he knows when I want to get off the phone because I just start reflecting. But usually, if somebody's talking about something that they're really interested in, and you do this, it's going to help them sort through the mixed up mess that it is, right? So basic reflection is basically repeating, right? Oh, I don't know what to do about this DWI. You don't know what to do about this DWI. And you notice I make it a statement, right? I don't say, you don't know what to do about this DWI, right? My voice doesn't go up like that, because then that's a like, tell me more, right? I want to make sure it's a statement, so I'm reflecting. So if they want to tell me more, they can. If they want to move to another topic, they can. Right? So I say, you don't know what to do about this DWI. And they could say, yeah, man, it's going to cost a lot of money. Or they could say, and I'm also kind of upset about the car, right? They can go, it's client-centered. They can go on whatever it is they want. Right? So repeating is one, and then rephrasing is one. And I'm not going to drive you nuts about that, but it's just getting out your thesaurus. Like, you don't know what to do about this DWI? It'd be a basic, right? Repeating, or this DWI is really on your mind. Okay? So I've just kind of moved it around, rephrased, but it's basically the same idea. All right. I want to emphasize another one that doesn't seem to be here, and that's reflecting feelings. Right? Ideally, I want to get into the range domain of emotion. So nobody ever really changes because of logic. They change because of a feeling, right? So the client might say, I don't know what to do about this DWI. And I could reflect, DWI has got you worried, right? Which is a little bit of a leap, but now I'm in the feeling domain. And they'll either say, oh my God, yeah, I'm fretting my ass off. Or it's not that I'm worried, it's that I'm pissed, right? Doesn't matter. So I was wrong. Oh, big deal. Now we're in the domain of affect, right? Now we're talking about feelings, and that's why people actually go ahead and change. Another kind, the double-sided reflection, all right? And this is all about the incarnation of developing discrepancy, right? I'm going to let the person see both sides of the discrepancy based on things he or she has already said. So I like this one Jamie has. You like going to parties, and at the same time, you also feel guilty when you're hungover, right? Just real matter of fact. Here's two things. They don't exactly make sense. And I don't say, what are you going to do about that? Or, hey, you're an asshole. But just like, here's what's so. Like going to parties, feel guilty when you're hungover. Right? And again, it's a statement. So they can say, yeah, the hungover's terrible. Or they can say, stop talking to me. Whatever they want. Right? It's all theirs. But I've not only developed the discrepancy, I've presented it to them on a platter. Right? And amplified reflection, you got to be careful with this one. And I got to admit, sometimes I think I'm joking around and I end up doing this and confusing the hell out of clients. But what you're going to do is you're going to take what the client said and go even further, right? You're going to push it out there even more than they say, right? So I had a guy at the VA who, like, his liver enzymes were terrible. He had at least 2 EWIs. And I said, so tell me about alcohol problems. And he was like, what problem? What are you talking about? And so I just reflected, oh, I'm sorry. You don't have any alcohol problems. Right? Which was totally bullshit, and we both knew it, right? But I'm taking what he says and pushing it even further, right? Sometimes I'll go even more, right? Talking to a client about safe sex. So it's like, oh man, condoms are too much trouble. Right? And I'll say, oh man, they're just more effort than they're worth. Right? Which isn't what he said exactly, but I'm pushing it a little further. Right? And then I'll say, well, I didn't say that, right? So that he's again arguing for change, not me, but I took his argument against change and really sort of threw it even further. Right? Amplified really just means so you make it even stronger than what they said. All right, so you get the idea. These are the different kinds of reflection. And then summaries. Literally what it sounds like. Listen for a while and let them have it. Right? So they go off on a big old chatter if they're willing. And if you've been nodding your head and been a good listener, they probably will. And you say, so you really enjoy the taste of crack, and on the other hand, the amount you spend is taking away money you could be spending on your 3-year-old. All right, so kind of a double-sided reflection part there. And you also are losing your teeth, which makes it hard to eat, right? Just kind of summing up the whole deal. Right? It's a great thing to do, I hate to say it, when you don't know what to say. So sometimes clients are just laying a million things on you and you're not sure which one they want to do first, so you just lay them all out. And then, hey, when you've got a friend who's talking and you want to help them focus, this is a great way to do that too. Well, so what to do? Basically, you're going to constantly explore the readiness and the ambivalence, right? Let them talk about how they feel, what they think, what they do, what they want to do, right? People are going to move forward and back through the stages of change in really weird ways, right? And I hate to see it. Like my grad students think, oh, it's been 20 minutes and we haven't figured out how to fix it yet, right? No, right? We got some chronic contemplators in the world. My dad talked to him for 30 years before he could quit smoking cigarettes, right? And they're going to sound like they're really moving in the right direction, but then they want to just step back again. Right? If they're not ready, there will be no change, and they'll start to show some kind of resistance. They'll start to hedge. The other key thing, and I think this is important, is you ask permission before you explain anything or offer any suggestions, right? So you can say, oh yeah, I know some guys who've used the patch for quitting smoking. We can get into that if you want, right? And then maybe they'll say, oh, yeah, no, tell me all about it. And maybe they'll say no. If a client, of course, says, will you stop asking me? That's why I'm here. But I'd rather err in that direction, right? So always ask permission before you give any advice. And then you're going to explore the ambivalence, the key area to target to encourage change, right? I'm just going to keep asking. I'm just going to keep reflecting, right? And ideally, I'll reflect more than I'll question, markedly more, right? I'll just keep giving back to them the things they're saying to me so they can see them, and then maybe they'll subjectively weigh each of the pros and each of the cons a little differently to inspire them to move into action. All right, we're 20 minutes in here. I do want to spend a little more time on this, so we're going to call it right here. We're going to have a motivational interviewing 3 coming up right after this. Take your break, write some questions, you'll be in business.